Imagine this. A man lies on a stone slab in a dark cave. His skull has just been fractured in a hunting accident. Blood runs down his temple. Around him, others are preparing to cut into his skull, to relieve pressure, to save his life. There are no hospitals, no anesthesia, no sterile tools, and yet the patient survives. This isn't fiction, it's history. Across the ancient world, from the Andes to Europe to the Middle East, archaeologists have uncovered thousands of skulls with precise, deliberate holes cut into them, not caused by violence, but by human hands, and many of them show signs of healing. The practice is called trepanation, one of the oldest known surgical procedures, but it raises a difficult question. How did they do it without painkillers? What did anesthesia look like in the Stone Age? To understand that, we need to begin with something often overlooked, the need. In the ancient world, trauma was common. Broken bones, cracked skulls, infected limbs. There was no emergency room, no sterile operating table. If someone didn't intervene, the result was often death. The earliest surgeries weren't optional. They were acts of desperation. And the question wasn't, should we operate? It was, how do we survive this? Which leads us directly to the challenge of pain. How did they manage it? Modern anesthesia, as we know it, wasn't developed until the 1800s. Ether, chloroform, morphine, these are all relatively recent discoveries. But the desire to dull pain, to make surgery survivable, is much, much older. In prehistoric societies, pain relief likely came from a blend of natural substances, ritual practices, and psychological manipulation, all developed through generations of observation, experimentation, and cultural memory. So, what did Stone Age anesthesia actually look like? First, fermented alcohol. Nearly every early society discovered fermentation. Whether it was honey mead, fermented berries, or barley beer, alcohol served a dual purpose. It was a social lubricant and a crude form of pain relief. Before surgery, a patient may have been encouraged or forced to drink large quantities of alcohol, not enough to knock them out completely, but enough to dull their senses. Second, herbal sedatives and intoxicants. Across different regions, early humans experimented with plants that altered perception. Leaves, roots, and resins with numbing, hallucinogenic, or sedative effects were identified and passed down orally. Substances like wild lettuce, poppy, mandrake, or henbane weren't understood chemically, but their effects were observed. In large doses, they could reduce pain, induce sleep, or create altered states of consciousness. Third, smoke and inhalation. Some early healers may have used smoke, not just for ritual, but for effect. Burning certain herbs and resins in an enclosed space could calm the patient or disorient them. Whether intentional or incidental, the use of smoke inhalation may have played a part in numbing the body or distracting the mind. Fourth, speed and restraint. Let's not forget, in many cases, there was no way to remove pain, only to outrun it. Patients were likely physically restrained using leather, vines, or muscle power. The surgeon worked fast with stone or bronze tools before the shock could become overwhelming. Pain wasn't eliminated, it was endured. And fifth, ritual and belief. In tightly knit tribal groups, healing wasn't just physical, it was spiritual. Belief in the healer, trust in the ritual, the presence of family, or chance, all help to alter the patient's mental state. What we now call the placebo effect, they may have experienced as divine protection. The line between belief and biology wasn't so clear. Now imagine it all put together. A man suffers a skull fracture. The healer declares trepanation is necessary. The patient drinks fermented mash, smokes a burning herb. He's held down. The healer, using a flint blade, begins scraping through the skull, slowly, carefully. The man screams or passes out or falls into trance. The ritual ends. Weeks later, the bone shows signs of healing. It happened. Not once, but thousands of times. The evidence is in the bones. So, what does all this tell us? First, anesthesia didn't start with chemistry. It started with creativity. Ancient people didn't have machines or formulas, but they worked with what they had: plants, rituals, observation, and trust. Second, they succeeded more often than we give them credit for. Some survival rates for trepanation in ancient Peru, for instance, were higher than those in 19th century battlefield surgery. And third, pain didn't stop them from operating. They faced it directly. They planned for it. And in many ways, they built the foundation for all future medicine. What did anesthesia look like in the Stone Age? It looked like alcohol, like burned leaves, like chewed roots and bound limbs. It looked like a cave full of smoke and chanting, a flint tool, a healer's hands. It looked like survival, primitive, maybe, but effective enough to build a future. And sometimes that's all you need.